everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to be going over lung anatomy and the physiology of gas exchange. This video is part of an NCLEX review series over respiratory disorders, so be sure to check out those other videos in this series. And as always, over here on the side and in the description below, you can access the quiz and the notes that go along with this lecture. So let's get started. First, let's start out talking about the role of the lungs. What do the lungs do? The lungs remove carbon dioxide from our body, and it does this by exhaling. And carbon dioxide is a waste product from metabolism, and it replenishes the body with fresh oxygen. And it does this by whenever we inhale. Whenever we breathe in, we're taking in oxygen. It's going to go down through our lungs, and here in a second you'll see how that oxygen is transported to those red blood cells to replenish your body. And another thing to remember is that your heart and lungs work together to make this gas exchange happen, because what your heart does is it drains all that used up blood that your body has used, which is unoxygenated. It pumps it to the lungs, which will take it through the pulmonary artery to the lungs to get oxygenated. Then the pulmonary vein will drain that oxygenated blood back from the lungs, and it will pump that fresh blood that your body needs with oxygen in it. So your heart and your lungs go together. Now let's look at the anatomy of the lungs up close. Okay, air that you inhale with oxygen will enter in through your nose and through your mouth, and it will go down through your upper respiratory system, which will include your nasal cavities, down through your larynx, and here is your thyroid cartilage, and then there's your cricoid cartilage, and then it will enter down through the lower respiratory system, which includes your trachea, and the trachea will branch off into the bronchus at the carina, this cartilage triangular area. And you will have your primary bronchi, which is your right and left bronchus. And the bronchus enter into the lungs at the hilum. Also, what enters into your lungs at the hilum are your pulmonary arteries and your pulmonary veins, which are from the heart, because remember, the heart and the lungs work together. So the pulmonary artery will deliver blood to the lungs to get oxygenated, because it carries unoxygenated blood. Then gas exchange will occur in the alveolar sacs and the alveoli, and it will drain that fresh oxygenated blood back through the pulmonary artery, and the heart will pump that oxygenated blood through the aorta, and it will go to the tissues in the body and replenish it with fresh oxygen. Then your primary bronchi will further branch off into the lungs into lobar bronchi, which are also known as secondary bronchi. Then it goes even further into tertiary bronchi, also known as segmental bronchi. And then the segmental will go into even smaller little airways known as bronchioles. And to connect the bronchioles to the alveolar sacs, you will have alveolar ducts. And then you will have the alveolar sacs, which are the purple little sac areas in the lung. And then inside this are alveoli, and this is where gas exchange occurs. Now let's talk a little bit about the lung itself. Here you have the right lung and you have the left lung. The right lung is made up of 3 lobes. You have the right upper, the right middle, and the right lower. Then you have the left upper and the left lower. So notice the left lung only has 2 lobes, where the right lung has 3 lobes. Then your lung is made up of 2 layers with some serous fluid in the middle of it. Here, the area in the red is your visceral layer. Visceral is surrounding the lung. The lung's a vital organ. Visceral, VI, remember that visceral attaches to the vital organ itself. That is how I remember it. And then you'll have the little area of serous fluid in between that, and then you'll have the pleural layer, which will be surrounded around the lungs, around where the thoracic cavity is. And what that little serous fluid does is allows the lungs to glide on each other as you breathe in and breathe out to prevent any friction. Okay, now let's talk about what is going on with the body physically whenever we are inhaling and exhaling. Because there are a lot of things that are going into play while we're doing these simple tasks. Your lungs are working, your heart, your diaphragm, and your accessory muscles to get this simple inhalation and exhalation done. So what happens is that you breathe in oxygen through your nose, through this whole system that we went over. And what happens to allow you to do this is that your diaphragm will contract. And right now, when it's curved up like this, it's in the relaxed position, but it contracts and it lowers. And whenever it lowers down, this creates a negative pressure, which allows you to suck in that oxygen and fill those lungs. So oxygen travels everywhere. It hits those alveolar sacs, and this is where the gas exchange occurs. Then carbon dioxide will enter in, and it's time for exhaling. So what happens is that this diaphragm will relax. It creates this, you already have this high pressure in your lungs, which will allow you to force that air out, which will include the carbon dioxide and the water. So what is happening on that microscopic level between the carbon dioxide and oxygen? So let's take a look. Okay, so what's happening is you're breathing in, you're breathing out, and during this whole time, these little sacs right here, your alveolar sacs, are inflating and deflating because you're having the constant transport of carbon dioxide out and oxygen in. So on each sac that you have capillaries, and these capillaries are originating from the pulmonary vein and the pulmonary artery. And remember, your pulmonary artery is taking unoxygenated blood from the heart to get replenished, so it can take it back through the pulmonary vein to the heart, to the aorta, and replenish the body. So what happens, let's look at it right here. This is just like an individual alveoli blown up so you can see it, and you have the little capillary here. So you have what came from the heart, the unoxygenated cells that are releasing their waste product of CO2 into the respiratory system so you can breathe it out and it can leave. And then it's also taking in the oxygen that you just breathed in and attaching itself to these red blood cells. So they're turning red and they're going back through the pulmonary vein to the heart. So what's happening is carbon dioxide and oxygen is transporting across this thin little capillary wall, and you have this constant exchange of carbon dioxide, oxygen, carbon dioxide, oxygen. Think of it as like an assembly line of all these little red blood cells lined up. These ones are the exhausted ones who are getting rid of their waste product of CO2, and then the oxygen's coming and attaching to them and making them feel better, and they're going to go back and do their job. So that is what happens in a nutshell with gas exchange whenever you're breathing in and breathing out in these alveolar sacs. Okay, that was about lung anatomy and the physiology of gas exchange. Be sure to check out my other respiratory videos, and thank you so much for watching, and please consider subscribing to this YouTube channel.